Hi all, this is Dr. Kingston, and in this video I'll be talking about the Pterygopalatine Fossa. The objectives for this session are to identify the walls and boundaries of the fossa and to describe the major structures residing there. To find the Pterygopalatine Fossa, we first have to find the Pterygomaxillary Fissure. But before we go ahead and find that, it is a good idea to orient yourself to the images in this slide because they are not intuitive. But they do a good job of showing what they need to once you've got a little bit more of an idea of what's going on. So on the left over here is a lateral view of the skull, and it's zoomed in on the infratemporal region. So the bones making up the walls of this area are colored and labeled. So you've got maxilla in orange, you've got zygomatic in temporal in purple, and then you've got sphenoid in green, and we have a very small little slip of palatine bone here in sky blue. Coming over to the right then, what you're looking at over here is essentially just the inside of the image on the left. So it's the same bones, you're just looking at it as if someone has cut the skull directly down the middle of the orbit here. So we're seeing the inside of the maxilla here, where we were seeing the outside over here. Same thing with the zygomatic and the sphenoid. All right, so now that we've got ourselves oriented here, let's pop in the pterygomaxillary fissure. And just like its name says, this is a crack that is located in between the lateral pterygoid plates of the sphenoid and the maxilla. This is going to be our pathway in to observe the Pterygopalatine Fossa. So I find it helpful to think of the Pterygopalatine Fossa as a cave. And the Pterygomaxillary Fissure is the big gaping entrance to the cave that we can walk through and explore what's in there and find some smaller passages inside. The boundaries of the fossa are very similar to those of the Pterygomaxillary Fissure. So we've got the maxilla anteriorly and the greater wing of the sphenoid here posteriorly. But because the fossa is three-dimensional, where that fissure is just two-dimensional, it's also going to have a roof and a medial wall. So the roof is made up by the body of the sphenoid, and the medial wall, which we can't see very well, would be in here, is going to be made up by the palatine bone. Now, once you make your way into this cave of the Pterygopalatine Fossa, you're going to spot a number of other openings. The fossa has communications with a number of other spaces in the head. So we already know that it's open to the infratemporal fossa through that pterygomaxillary fissure laterally. If we move medially, we find the sphenopalatine foramen, which will take us into the nasal cavity. And now we're going to jump over to the right side image for the others here because they're easier to see from a medial view. All right, posteriorly on the body of the sphenoid, there are two passageways. So we have the foramen rotundum is the more superior of the two, and the pterygoid canal is the more inferior. Hopefully foramen rotundum sounds familiar to you, as that is the passageway that is going to take the maxillary nerve or the maxillary division of trigeminal out of the middle cranial fossa. All right, anteriorly here, we find the inferior orbital fissure, which will lead into the orbit and eventually out onto the midface. And inferiorly then, we're going to find the greater and lesser palatine canals, which are going to lead into the oral cavity. Now, with all of these communications, it has probably already occurred to you that there must be a decent number of things passing in and out of the Pterygopalatine Fossa. And you are definitely correct. There's really only one full-time residence here, and that is the pterygopalatine ganglion. That is going to take up most of the room in the fossa. So remember, the pterygopalatine ganglion is one of our parasympathetic ganglia, and it's going to be housing postganglionic parasympathetic cell bodies for neurons that are going to head out to the lacrimal gland and to the mucus glands in the nasal and oral cavities. It is going to be receiving preganglionic axons from the facial nerve via the greater petrosal nerve. The rest of the structures in the Pterygopalatine Fossa are kind of playing peekaboo as they move in and out of the region. These are going to be branches of the maxillary nerve as it comes out of foramen rotundum, and branches from the third part of the maxillary artery. I am going to leave that description intentionally broad for right now. The maxillary nerve branches and maxillary artery branches in this region both have enough material that they really deserve their own learning objective. So we will be going through them in great detail in sessions to come here. All right, so that is where I will leave this learning objective. And here is a practice question for you. Correct answer here is B, the nasal cavity. And the sphenopalatine foramen, so over here on the left, that big hole right there, is on the medial wall of the Pterygopalatine fossa, and that is going to connect this space into the nasal cavity. And that brings us to the end. Thank you for watching.